Hi, I'm Gail from Vein Access Technologies. And this is going to be a quick video on causes of IV infiltration that nursing school never taught us. There are 6, and we're going to be covering them now. The primary cause is selecting a hand vein. Next, use of that tourniquet. The 15 to 30 degree needle angle of entry makes a problem. Infusion rate, the sedentary patient, and bolus injections. Selecting a hand vein is the next problem. The hand vein is the thinnest walled vein in the human body when we're talking about superficial peripheral veins for venipuncture. Vein walls and all vessel walls have 3 layers of tissue with a middle layer of smooth muscle. It's called the media. And according to Gray's Anatomy and other anatomists, the most distal superficial veins in the hand may even be missing that middle layer of muscle. This makes this vein, venule and venous part of the capillary bed, very vulnerable to leakage and makes the vein very vulnerable to rupture. You've all seen that with hand IVs. The next culprit is the tourniquet, and especially when you marry it to the hand vein. What the tourniquet does, as soon as you put it on, causes an over-distension of the vein. It's not a dilatation, it's a forced over-distension. And as the vein fills with blood, the walls thin, and the blood pressure in that vein goes up. And when it exceeds normal for that segment of vein, the system leaks. It leaks at the vein, the venule, and the venous part of the capillary bed. There you go. There's your infiltration. There are plethora of articles out there written by PhDs and MDs on this very subject. Here are some of them. At your convenience, come back, pull out a title, put it into a search engine, and read. The other names for infiltration are extravasation, transudation, leakage, edema, lymphedema, and swelling. But an infiltration by any other name is still not a good thing. Next, it's the needle angle of entry. That low angle, and look at it there, cuts a lot of vein wall as you enter. That weakens the wall, sets it up for leakage and for rupture. And when you're infusing fluids and there's backflow, it puts more pressure on this wall yet. Next is the rate of infusion of those fluids. Think of the vein and its traveling blood as a superhighway. The cars are the RBCs, are traveling at 65 miles per hour, or the blood's flowing at a heart rate of 72 beats per minute, right? How fast can or should your infusing fluids or meds travel? No faster than the traffic is already moving. Because if you do, it's going to back up and back up against that long cut in that vein wall. Next, this has to do with flow, is the sedentary patient. Well, what does the IV patient typically do? Sit, don't move that arm, don't want to be stuck again. Or the nurse even says, don't move that arm, I don't want to have to start that IV again. Well, how does venous blood move around the body? We're all taught that. It's movement. Contracting skeletal muscles squeeze the veins and milks the blood along. So milking of the hand is not just a blood donation thing, and it's not a prior to the IV or during the start of the IV thing. It's after the tourniquet has been released and the IV fluids are flowing that people should be milking their hand, but they don't. This is a problem. Next is that bolus injections. You can't infuse anything faster than the traffic is moving, or you will over distend the vein yet again, putting more pressure on that long cut and that vein wall, causing more leakage at the venous part of the capillary bed. There's so much anatomy and physiology that you don't know about the vein because we weren't taught it. But think of the vein as a long, skinny, not over distended water balloon. And you can actually see a real vein here on an anatomy dissection. It's flat, it's thin walled, it's fragile. So IV infiltration is something that can be avoided. And nursing schools are in the process of adding STEM to their curriculum. Then this information will be taught in nursing schools. Until then, you need a vein access technology CE. With that training, we'll teach you how to avoid the infiltration. We'll teach you how to grade the vein and make sure it's one that's got a wall that's going to tolerate the stick and the infusion, and that you'll be selecting a wrist vein or an antecubital vein, not a hand vein, and that you'll be using a veni cuff instead of a tourniquet because the veni cuff only inflates to 20, supporting the vein. And you'll be using a 45-degree needle angle of entry. Sounds scary, but it's not. It cuts 1/5 the vein wall that your entry does. And you'll know when you're in. The infusion rate, well, that's going to have to be dictated and adjusted by the doctor, but the concept is adjust it to the rate of the flow of blood. Next, gravity. Instead of that arm just sitting there sedentary and you can't have them milk the hand for 24 hours a day for 3, 4, 5, 7 days for the length of the IV, then we're going to elevate that IV site to just above the level of the heart, whether they're sitting or they're laying, and let gravity bring blood back to the heart. And then the bolus injection of anything is always infuse slowly, never rapidly. Again, there's so much more to know, but this is the CE for IVs. And this venipuncture technique, this VAT method, is the next generation that you absolutely need if you're going to do IVs. So call us to schedule your training.